For our fishbone diagram, we used four key contributors identified from the patient scenario. People, management, lack of information, and policies are four vital contributors to the scenario. The issue started with inappropriate patient handoff in an acute inpatient setting. The transporter was unaware of the low level of oxygen in the tank and failed to consider the patient's safety was at risk. The on-call physician then did not visit and inquire about the patient's deteriorating status. The nurse was overwhelmed and not mindful of the acuity of the patient load, and the radiology technician was also short-staffed and prioritized another patient's care instead of the patient who was at risk, given an inappropriate direction to leave the patient unattended. The lack of involvement and unawareness from the charge nurse of providing an inappropriate assignment shows that there was a significant delay in the appropriateness of patient care. No education was given to the nurses regarding a standardized process of patient handoff during the transport process. There is an evident lack of policies to include transferring patients, as well as no policies in place that require an SBAR report to be given during each transfer of care. The patient was left alone, no family at the bedside, and the patient's condition significantly deteriorated, as the physician was unaware of the full background from the patient's condition, providing a negligence in patient care, leaving a patient at high risk for death.